So let's hope everybody can see our presentation. We're going to speak about gynecological procedures and the halacha. We'll speak about petichat hakever and which procedures call a woman to be niddah, etc. So we'll look at the sugya. The Mishnah Masechet Niddah says, "I'm a pelech haticha im yeshimat dam tmea b'mlav Torah." Woman's mapil something. If there's bleeding with it, she's tmea, and if not, she's Torah. Says the Gemara, Rabbi Yehuda Omer, ben kach ben kach tmea. Doesn't matter whether she saw blood or didn't see blood, she's tmea. The Gemara says in Masechet Niddah, b'daf chaf alef amud alef, Amar Nachman bar Yitzchak, be'efshar lepetichat hakever v'lo dam k'miflika. The machloket between Tanakama and Rabbi Yehuda is whether we have petichat hakever v'lo dam. Rabbi Yehuda is of the opinion that we don't have petichat hakever v'lo dam. Therefore, every time you have petichat hakever, there's going to be, the woman is asura because we saw there was blood. And the Chachamim say no, and if she's blood or not. What does it mean to believe petichat hakever? It says Rashi, petichat hakever berechem, v'lo dam, v'lo amar, dam echer ika, ve'anan hu de lo chazina. We don't say there's other blood, and we didn't see it. The kasavrei abanan, efshar petichat hakever v'lo dam. The Gemara, the Chachamim say, efshar petichat hakever v'lo dam. Rabbi Yehuda, afilu diuka v'levana temea devadai dam achera, ve'anan hu de lo chazina. There was blood, and we didn't see it. The efshar v'lo dam. The principle of efshar petichat hakever v'lo dam means that every time there's petichat hakever, every time we open the cervix, we know there's bleeding, even though we didn't see it. And that's the whole of the machloket Rabbi Yehuda and Hachamim. Continues the Shulchan Aruch. What does the Shulchan Aruch posek lemaisa? I'm a pele betoch 40, and choshesh levad, אבל חושש משום נידה, אפילו לא ראתה. Says the Shulchan Aruch, Kuf Sadi Daled, that a woman who's mapelet, we say she's tamea. Says the Rama, mipnei she'esh al petichat v'lo dam. And in Afkamina, he says if you can start counting the shiva nikim miyad, or do we need to have two matleda? And so the principle that we saw is lechora machloket hachamim and Rabbi Yehuda, and the Shulchan Aruch and the Rama posek that she'ifshar petichat hakever v'lo dam. Every time I open the kever, the woman's asura, and that's the reason why mapelet is asura. However, there's a very famous Gemara, Masechet Niddah daf chaf amud bet, that says, if a woman sees dam b'shvoferet, she sees dam in the tube, ma'u, what's the din? B'vsara, says the pasuk, dam b'vsara machmana v'lo b'shvoferet. She has to see b'vsara v'lo b'shvoferet. She has to see that the blood comes through, touches the flesh of the cervix, and doesn't just go through the shoferet, and therefore, since the blood didn't touch their basar, is muteret. That's a very famous Gemara because of Shlomo Zalman Auerbach. So I wanted to use that as a smach to say that a woman who ovulates prior to going to the mikveh, so if she puts in a shoferet and sees dam b'shoferet, then she will be tohora based on that Gemara. It's not very practical teruts, but that's what he said. So if that's the case, we say a woman's not a sur. However, everybody's got to jump up and say, rega. But Rabbi Yehuda's got to come and say, but she can asura. Why? Because she has petichat hakever. When she has petichat hakever, she's asura. Doesn't matter whether she saw b'vsara or no b'vsara. The problem that what makes it niddah is that the opening of the cervix itself was accompanied with blood. That's the horror shaila that we have on that Gemara. So we could say enachinami, that even that dam that she saw b'petichat hakever, she saw b'shoferet, if she would be muter. One teirut. Let's look at another couple of teirutzim. We have three other teirutzim on that Gemara. So the Shulchan Aruch says, the Gemara says, the Shulchan Aruch says that we need to, if a woman is mapelet, we need to know whether what she was mapelet, what she expelled, has blood in it or not. So what she needs, something was expelled from her. In which case do we know that? Says the Shulchan Aruch, but mapelet come in klipot v'sarot. If she expelled from her klipot, sarot, some small pieces, אבל החתיכת דם, הבדיקה ששווה, אין נמוך תמיה. ויש לנו גם לזה צריך בדיקת שרייה. אם היא חתיכה קטנה כשיעור שפופרת, הקנה, דק שבדקים. So the Shulchan Aruch says that if it was באמת דבר דק שבדקים, then a woman who expelled that thing isn't תמיה. I.e., therefore, what do we just say? We said that shvoferet means dak, kanei dak shebedakim. that if we have if she puts in a shvoferet that's very, very narrow, she won't have ptichat hakever. Or put in other words, when we say ptichat hakever, it doesn't mean every single time anything goes inside the uterus, but any time that we have a widening of the cervix. We said in a moment in the Nishmat Avraham that he says that the idea is that the cervix is a little bit widened than it already was to begin with. Less than that, which is considered to be kaneh daksha b'dakim, is not considered ptichat hakever. So the question now, so that's one answer. The answer would be that roa b'shvoferet is muteret. Why? Because a shvoferet is very thin and therefore doesn't cause ptichat hakever. The question that we'd have to say is, what is kaneh daksha b'dakim? What does that mean? So some poskim say that's 3 or 4 millimeters, because once the cervix is already open 3 millimeters, anything more beyond that is a ptichat hakever. Some say that it has to be already a significant amount of opening. What is it? 7 millimeters, 10 millimeters. Rav Moshe's very famous tshuva is probably the most lenient, and we'll see in a moment how we get to that. So the Mishnah that the Rav Moshe builds on is the Mishnah Masechet Orlot. The Mishnah speaks about a woman that starts giving birth in one room, and then is taken to another room and delivers a baby who dies. So the question is, in which houses do we have tumat met? Isha maksha, she maksha le'levutzia mibayit lebayit, harishon tameh misafek, v'sheni bevadai. The first house is a safek because maybe there was already Niddah there, and therefore we have the met in that house. And the second house is a vadai because the second house the met lefanenu. Amar Yehuda emot tabizman shehi natelet b'kapayim. When are we saying that she went from the first house is a safek when she had to be carried from house to house? If she had to be carried from the first house to the second house, then we can say that Niddah already started in the first house. Again, this Mishnah is very important because it's a siman of when does Niddah start? When is a woman considered to be tumat Niddah? We'll speak about it maybe another occasion. But if the woman can walk from house 1 to house 2, or it doesn't have to be house, it could be from room 1 to room 2, a rishon tahor, then it's clearly that is mutter. Why? When the kever opens, a woman can't walk. And therefore, when we speak about ptichat hakever, says the Mishnah, it's only because that they already have what we call what is called medically today crowning. That the crown of the head already starts entering the birth canal, and as crown of the head starts entering the birth canal, then it's considered to be already ptichat hakever. So we have here a shiur. What's a shiur? Kapika. What's a pika? So pika is a bobbin, and if anybody learned Hilchot Niddah, Hilchot Shabbat about weaving, so to know that one of the malachot of Shabbat is ariga, is to weave, and the Gemara speaks there about shnei betei nirin, that it was to make two the loom in which was weave, and we have a shtiva erev. So we have the cords going one way, and you have the cord that goes on the cross to create the stitch. And what happens is you have a big loom, and on a loom you put in all the cords going one direction, and there's 2 of them. So there's 2 looms. One is they can with a pedal from the foot, they can be lifted and lowered, and then you throw the other chut along the loom and then push it down in order that you get the stitch. What do you that thing, the chut, if you throw it along, has to be attached to something. It's attached to the bobbin. That's a bobbin. That's kapika. When the Mishnah says rosh kapika, this is the pika. And here's a picture of pikot. Here's a picture of bobbins. You can see there's some that attach the chutim and some not attach the chutim. That's what it is. Every time we go to see someone weaving, so I always look at the size of the bobbin. See what it is. Every size is a little bit different. And that's the rosh kapika. That's the only shiur we have. So that's what Moshe says. But Moshe says in his tshuva, "Ela pashut shu kashiur ne'emar b'madit do'olot inyan tumat hu mishagil rosh kapika." That's shiur chelo matzana. We never found any other shiur of what's called ptichat hakever. That we can say kaneh daksha hakever doesn't mean anything. That's not a shiur. The only shiur we have is kipika. What is a pika? So Rav Moshe says, "Dechein av shelo yadu lanu shiur pika." We know what a shiur is. Pika is. It makes sense that it has to be something that's not 3 millimeters. It has to be something that's heavy enough to be tied to the chut and to be thrown across the loom. It has to be something that has a mishkan. Has to have a size. So Rashi says, so Rav Moshe says, so if it's less than the small finger, then yesh lakel. If we go back to the bobbins, it seems that seems to be a minimum shear that we'd have. What of the small finger? Fingers in halacha are considered to be 2 centimeters. So anything less than that is not considered to be p'tichat hakever. To be p'tichat hakever has to open more than 19 millimeters. That's how Rav Moshe got to the tshuva. So the Rav Moshe defines kanedaksha b'dakim as a bobbin, as a pika, whatever. And since he says we don't know what a bobbin is, because a bobbin can be different things, the svara is that it has to be at least the size of an etzba ktana. What's the etzba ktana? 2 centimeters. That's to be 2 centimeters. Ubifrad, another. So that's the first tshuva. Another tshuva of how can we say that the wabish faferet is not a surah? Ubifrad she'etzem adin she'ein p'tichat hakever belodam eno din baru. So pashut that's the din. It's machlokas. There's already machlokas in the Mishnah. It's true that the Shulchan Aruch says it. Aval the ha Rambam v'dimei lo pasku zeh. It's affected in. It's affected in. We don't know. Rambam doesn't say it. There's another tshuva. Maybe the answer that we saw, the Arabu Shoferet, is that Ein Achinami. She didn't. We don't hold like P'tichat hakever. We don't hold like Rabbi Yehuda. So that's 2 answers that we saw, or 3 answers potentially. One is answer you saw maybe in the Shoferet. The other possibility is that the P'tichat hakever has to be a certain minimum amount, and the Shoferet is not. And the third possibility, as we just said, is that we don't hold like P'tichat hakever. Nishmat Avram comes to explain exactly the medicine of the halacha that we just saw. So he says the following: the cervix is open. The cervix is not a closed organ that nothing can pass through. Otherwise, one would never get a period. So it has to be open a little bit. How much is open? It's open about 3 millimeters. Obviously, a woman that's been polypartum, that's given birth many times, will be open a little bit more. But that's a shiur keragil is about 3 millimeters. There are certain tests, we're going to speak to them in a moment, that in which we would place in a instrument that is 12 millimeters. We have no bedika that we know that you put 20 millimeters inside the rechem. You would cause incredible damage. You would rupture the cervix by doing such a thing. It causes great damage. It's clear that today, most of the treatments that we'll see, many treatments that we're going to see in a moment, are less than 3 millimeters, or 3 millimeters and around more or less 3 millimeters. So Nishmat Avram says that if we hold by Rav Moshe, there's never p'tichat hakever. We have no medical treatment. Birth is clearly p'tichat hakever. We have no medical treatment in which the result is p'tichat hakever, and as we saw, bleeding. So if we hold by like Moshe, and Rav Moshe seems to be pretty mevusas psak, not only in America but even here. We heard from Talmidim of Shlomo Zalman and others that it was a psak makubal like Rav Moshe Shalakel Bezeh. So therefore, we don't say that there's any really treatment that is p'tichat hakever, unless we hold like another posek that holds differently. So that's the Nishmat Avram. That's the explanation of the medicine. However, Rav Vosner had another psak. Rav Vosner Shur Shevet Levin Kuf Pechet says, we have a special test, such as silum rechem, such as an HSG, hydrosonogram, or shtifat chototzot, or we ecovis, that we wash out the fallopian tubes. Anytime we open a rechem, we have to be machmir. And that's a minhag. I don't know if it's such a minhag, that's what we hold, but that's what he holds. That's what he holds it. That's a minhag. But why do we have to be machmir? So I think we can say 2 svaras of the Shevet Levi who is machmir. The first svara to be machmir is that anytime we go inside the uterus, maybe we have a suffix of p'tichat hakever. Even if we said, if we don't know, even if we didn't see dam or anything, even if it's very dark, we load it. P'tichat hakever is one that we have to be machmir. And the second thing that the svara is that the Shevet Levi says the following: is that oftentimes we will see bleeding. And we'll say, Tov, it's a makkah. But he says, how do you know that once you went inside the uterus, that the uterus didn't mitarer lotzidam? Lotzidam is called p'tichat hakever. That's exactly what we call it. And therefore, it's very possible that even though you're going to say that it's only, that's not called ptichat hakever, that's a makeh. He said once you went inside the uterus, and he load that, and therefore he says then it have to be machmir. We'll see. Maybe if we have time, I'll tell you a story later with Talmidim and Rav Wosner how they hold by this. So the chora kunda Rav Wosner. Every time you go inside any treatment, you go inside the uterus, not something outside the uterus. Anytime you go inside the uterus, the chora there's a suffix. A woman will be in there. Vada if you see bleeding. We'll see in a moment. That's not so pashut. So if you understand, there's also machloket as to whether ptichat hakever refers to the internal os, the teeth that are closer to the uterus, or what's called the external os, the external teeth, the teeth that are further away from the uterus. So it's a gam machloket. We don't exactly know which is which. So it's ptichat hakever is here. That's we're also going to be more machmer than if we say ptichat hakever is here. That's clear to everybody. That's what I just said. That's a nakuda that I think not everybody's so around. That makes sense? Again, I have no idea. No one's here. It's like I'm talking to myself. So, Ken, someone, anybody, Mishu, Lo, Afchad. Okay. Baror, the only person sees Rabbi Bucket. Rabbi Bucket, you can see it's Baror. Yeah, he seems to be very happy.
I hear you clearly.
Yeah. Okay, it makes sense. It makes sense that we're talking. This is the question whether this particular. Just want to know that. Otherwise, the people in say we didn't understand. Okay, that's the third. That's the third. One other answer is a very famous machlokas and achronim that I think the best sikkum is in Aruch HaShulchan, as in many other things, and the Aruch HaShulchan says the following. But that יש מי שרוצה להגיד, לומר, when we say there's no פתיחת הקבר בלא דם, זהו במשיכת על ידי יציאה וחתיכה מבפנים. That's only when something is expelled from inside the uterus out of the uterus. That is a question of p'tichat hakever. אבל פתיחה מבחוץ, where we open it from outside, כמו נדי שפופרת, או רופא שנכנס כדי להפנים, כדי כלים לפנים מן המקור, ובזה לא אומרים אי אפשר פתיחת הקבר בלא דם. So he brings the name of Tefillah Moshe, it appears in Niddah and Pitchet Shuv and other places, that there were achronim who said that really p'tichat hakever is only when it comes to the inside out. But if it comes to the outside in, that's not considered a p'tichat hakever. Why? Because the svara is that the body didn't mitorer lotzi dam. According to we understand Rashi's pshat in the Gemara in Masechet Niddah, that be'emet we think that the body's mitorer lotzi dam, even though we didn't see it. That's the chora when it's something that comes from the outside in. From the inside, out. When it comes to when expelled from inside the body, but if it comes to the outside in, who says that there's a traumatic experience to the uterus? That's the chordah svara. So that's the third answer, or the third and a half answer, is that why? How come the rabba shoferet is muteret? Because when it comes from the outside in, that's not considered p'tichat hakever. In any case, whatever happened, and of course you saw the bleeding is tinachem, but if we just saw no bleeding, says the Ruch HaShulchan, v'chalila lo marken. Doesn't make any sense. The Adraba, you tell Mistapa, it doesn't make any sense. Exact Ifcha Mistapa, exact opposite. Verkehrt. Mistapa, the alidei p'tichat hachutz, yoter gorem shiyored dam b'fnim, kefi asher tigom yitziat chaticha b'fnim, shiyored kefi tivo. He said, if when it's a natural process that something inside is expelled outside, we say there's p'tichat hakever as kal v'choimer. If it comes from the outside, what's more traumatic to the uterus? The natural experience of expelling something from inside, if it's a sarod, klipot, or even if it's a uterus, if it's an embryo, that's what's more traumatic, that, or that if we come from the outside and we stick something inside, it's more traumatic. It's I would say the exact opposite. And he said it's also the pshat of all the poskim. It's only the achronim started to say that. No, none of the rishonim say that. He says, what's the svara? Exactly how sugya. That we see that therefore you need b'shvaferet dakshin b'takim. What does it have to be dakshin b'takim? What does the Shulchan say that? It says any shvaferet. Answer is because the Shulchan holds that there is p'tichat hakever if a shvaferet, and therefore you see that we don't have a chiluk. We can't get up nobody. That brings it to nobody that we just said coincident and doche. Pitchet Shuv is doche. Chen shemati pi rofim mumche. He said that when we have a forceps delivery, that they stick in milkachim, they stick in a forceps, it only goes out of the it only goes into the vagina, it doesn't go to the uterus. Therefore, in such a case, not called p'tichat hakever. With the verse, this is probably the most important line we're going to say in the whole course. We mentioned this before many times. This thing needs drisha v'chakira min harofen. You have to go and ask doctors, i.e., if I just have a new procedure Go and ask a doctor. Something I don't know about. Ask a doctor. What do they do? Then we'll give the psak. We can't give the psak without knowing. And it's very important because those things change. What was done once, maybe not be what's done later on. And what I think I understood from the woman was in fact something else completely different. The woman just called me now a few minutes ago. And she said she had the doctor did a test. He went inside the uterus, looked all inside the uterus. Okay, that could be several tests. That could have been an ultrasound. That could be a hysteroscopy. That could be an HSG. There's several things that could be that describe that. What she was describing sounded like an ultrasound. But her description could be relevant to 3 different types of treatment, maybe even Ecovista, maybe other things as well. What exactly happened before we give him? So that's the Tzada Ilchati that we said, L'chora, there are 4 svaras of why we don't have P'tichat HaKever. Either we don't have P'tichat HaKever Bichlal, or the woman saw in the Shvaferet, and therefore that's not called P'tichat HaKever. That's not called Bivsara, and therefore she's Muteret. Or that is Kanei Daksha B'Dakim, or that only when you put from the outside, from the inside out, is a P'tichat HaKever, not the opposite. So that's a very nice sugya. And we're going to hold by the idea that we do hold P'tichat HaKever, because the Chor Shulchan Aruch with the sword. And we're going to hold that there is P'tichat HaKever, in essence, a minimum amount. And then we're taking that understanding, we can look through several treatments. In addition to that whole sugya, there's of course the whole very famous sugya in the Gemara, Masechet Niddah, that Ne'emenet Yeshalom Makashi B'Makor, Shemen Adam Yotzeh, Divrei Rebbe. So many people understand. They remember the Gemara says Ne'emenet Yeshalom Makashi B'Tomakom. That's not what it says. Otomakom could mean the vagina. Makor means the uterus, i.e., a bleeding that comes from the uterus is a makkah. It's not only bleeding comes from vagina. Bleeding comes from vagina, the shayla doesn't start bichlal. Why? Because bleeding for anything from the vagina is not uterine bleeding. And only uterine bleeding is a half a minute that could be needed. And therefore, whatever happens in the vagina is pashut. We don't need a woman to say that. It's any day levad. And therefore, it's dam that comes from the uterus that she's able to say mutter. That it comes from, it's a makkah. Rabbi Shimon Gamliel dam makkah haba min hamakor tameh. Rabbi Shimon Gamliel disagrees. He said even dam that comes from makor, comes from the makor, so tameh. However, the Rabbi Tenu idu al dam makkah haba min hamakor shutao. Machloket even whether that is mutar. The dam that comes from the uterus, if it's a makkah, lachor psak lalacha shezeni ka makkah. What is called from the uterus? So the Chazon Ish says in his psak, he says that it's dam that comes from the uterine lining, like what we call the endometrium. That's considered to be, if it's cut there, that's considered to be a makkah. However, in the letter of the Chazon Ish, he says that it's only if it was a cut in the basar, in the flesh. You remember that the uterus has flesh, and around the flesh is what we call muscle, right? Surrounding that is the endometrial lining. So if we cut the endometrial lining and that bleeds, let's go back to Rav Vosna. Rav Vosna said that's called dam niddah. Why? Because we don't know that you caused the makkah, but I don't know that the body didn't bitarer to bleed. However, the Chazon Ish Psak says that's considered to be makkah. However, in his letter, lo posek kacha, he says that it's l'chora a basar. Now, that's a machloket whether the Chazon Ish says different things in different places. The question that we hold by the letter.
That's a stupid question.
Then we hold by we should hold by the psak of the Chazon Ish. Again,
that's the one question. I just in the simple the Mishnah. How can a isha know that it's a dam memaka in her uterus? How can a isha know that?
So that's a good question. What's your answer?
No, I don't know. Through today.
That's such a good question. You have such a good question. You can't have an answer. You got to have an answer. Yeshi pshat. Pshat is very simple. And that's what I heard from many rabbonim, that in the past, women they were more conscious of what was going inside the uterus, what was going in their lives. How do we know that? Because we have the whole side of hargashot. A woman knows. No woman feels like that today. So women were more in contact, so they knew there was makayish. I have a more practical story today. What's the practical story? The doctor told you there was not a bleeding before. We went and did a procedure, and she sees bleeding. So we can say it's a makkah. That's the sugya. So Rav Shechter,
could I ask you? I'm sorry. Could you just clarify the stira and the Chazon Ish for me again? I just didn't understand.
So in the psak, in his Shulchan, in his Bior and Shulchan Aruch and Hilchos Niddah, so the Chazon Ish says, what does it mean in Makkah? Makkah means that you cut the endometrial lining. Okay, that endometrial lining bleeding is histologically, is biologically exactly identical to uterine bleeding, but it's still called a makkah because the source of that was not from the hormonal changes that caused the endometrial lining to break down, but it was from a makkah. However, in his letter, the Chazon Ish says that only if you cut the flesh of the uterus is it considered to be a makkah. Otherwise, it's considered to be dam niddah. That's the horse there. And almost everybody holds like the endometrial lining, not from the basar. Rav Shechter holds that only a cut in the basar itself is considered to be a makkah. Anything else would be considered to be dam niddah. It's a big chumrah. We'll see in a moment. How do we get to that chumrah? Okay. So let's go a little bit. So we understand a little bit of the biology. So we have again a question of what about if I make a cut between here and here? Is that considered to be a vagina? Vaginal bleeding that's considered to be uterus. Again, we said, how do we know that we have a makkah? What if it continues beyond having a makkah? So if we look at the uterus, we always looked at it this way. But if we look at it straight on, we'll see the cervix, and the cervix is the opening to the uterus. If we look at this, if we go back, we look at this ever, it's embedded inside the wall, inside the muscle wall is embedded the cervix. But in fact, if we look at it, and this is what, if you go to do a biological a gynecological examination, that's what they see, a little bit of sticking out. That's sticking out of the end of the uterus. That's called the cervix. So that's what we see. Now, if I have a mark on the cervix, I have a atrophy of the cervix, that's clearly considered to be a makkah. But what if I have it somewhat slightly inside? And so the amazing thing, is in fact the cells of the uterus and the cells of the cervix are different, or the cells of the vagina and the cells of the uterus are different. And if we look at inside the uterus, you have what's called columnar epithelial cells. These are cells that are stacked on one of each other. And outside, in the cervix and towards the vagina, you have what's called squamous, like they're all squashed together cells. There are two different types of cells. It's an amazing thing. And there's a transition area. There's a transformation zone in which somewhere here, it changes from being cells from the uterus to be cells from the cervix. Does that any nafkamina lochas? It's very madim. But it's really madim to think about it, that the actual cells are different. The cells of what's going on inside of the uterus, the cells what's going on in the vagina are two different types of cells. It's very madim. So anyway, so let's go to Maisa for all of the bedikas that we have, and every procedure that we have. I don't know if we're going to have enough time to see everyone, but we'll do it quickly, next half hour or so. And we'll see what to make a woman niddah. So speculum, woman goes to do a regular gynecological examination. She goes to a bodeket, she goes to a regular gynecologist, she comes to a postpartum, and she goes and they put in a speculum, which is a speculum because of what to see. So the speculum enables us to see the cervix and see what's going on in the vagina. That's what a bodeket does. We'll speak about bodeket. We'll have a whole share on the task of a bodeket, how she does it, what she does, what she can and cannot do. But that's the concept of the where she gets to. Does that make a woman niddah? The answer is no. Why? Well, first, it doesn't go inside the uterus. Second of all, if we see bleeding, if she's bleeding coming out of the uterus, the nacher, that's nothing to do with what she did. But if she sees bleeding as a result of her bedika, so we could pretty much clearly state that bleeding is not a result of the dam niddah, but it's a result of an abrasion that was caused by the insertion of the speculum. An abrasion of the speculum is not considered to be dam niddah in any way, shape, or form. There was in Rav Mordechai Eliyahu Zatzal's book, Darkei Tahara, in the first edition, or the second edition, there was it said that if it's possible that the doctor banged the speculum against the cervix and caused the opening tichat hakever. In a later version, that was taken out that because it seemed to be chumiyotera that non-mekubal mitzias. The other thing I would say that if your doctor bangs the speculum against the cervix that causes it to be open, then it's a good chance, it's a good opportunity to change a doctor That's a terrible thing would happen. The woman will be in great pain. We don't have that. So any woman comes, he said, I did a speculum. Does it make me Niddah? No. It may you Niddah every time you had relations, ever seen it. I saw bleeding afterwards. How much bleeding you saw? So a little bit on the speculum. It's a makkah, it's an abrasion. It's not even from the uterus, it's from the vagina, it's pashut. However, if the doctor says I saw bleeding coming out of the uterus, it's a din acher, then it's already have a problem. Agav urchav, we already said that. So it's very important. We'll speak about more when we speak about bodeket. It's very important to remember that many times a woman, let's say, sees bleeding during pregnancy. She was a ktamim. So we were matir. We said there's ktamim. She's on Makabel Tuman, on Sivoni, whatever. That's negris. And then she goes to the doctor. The doctor says the bleeding comes from the uterus. So now the woman's Niddah. So the question that they always say is, did the doctor see the bleeding coming out of the uterus, or did he just say, I don't find any other bleeding, therefore it must be from the uterus? Those two completely different psakim. If he saw it coming out of the uterus, then we have a bemet, we have a din doraita, because then we have a safek doraita with bahagasha lo bahagasha, therefore yasura. However, if it was he said, I don't find any other reason, and therefore misvara must be uterus, so that svara doesn't make any difference to us. I also can say misvara must be uterus. I use din halacha. Din halacha is we have a safek sveka. Safek men is lo mena. If it was mena, we have a safek bahagasha lo bahagasha. Therefore lochor matir. So therefore, if he says I saw blood coming out, it's din echad. If he says I don't know where it came from, and therefore I'm going to say I'm getting machmer stam because I don't know, so the chor in that case is halacha. It has no mashma. Second test, which is very, very common, is to do a pap smear. Do a pap smear. We take a Q-tip, a little bit longer Q-tip, and we put it inside the cervix. We scrape off and we get cells. Those cells are then cultured out to see whether the woman has HPV virus or other viruses that are related to cervical cancer, mostly cervical cancer. Other things as well, but mostly cervical cancer. So the here we clearly have entering the opening to the uterus. Again, we get into the question of whether that opening would be considered to be the uterus or not. And lechora, we'll see bleeding as a result of the pap smear. Ken, Rabbi Halpern wanted to ask something. Give together for you.
Yeah. Can you hear me?
Yeah, of course. Bavadai. Loud and clear.
Thank you so much for listening intently all along. So in terms of the doctor, let's say the doctor is not Jewish.
Yeah.
Does he have the same ne'emunus? And does that play into a factor over here?
It's a good shayla, but often klali about how do we samech on rofim or non rofim. I think what Moshe generally seems to be that if the doctor says a metzius, to the chora we can be it's a metzius. It is so he didn't see it. Chora, then we can be samech on it. I think so. Can't really.
L'chumra, you're saying. L'chumra, you're saying the same way. L'chumra.
Again, but the ma'isa is in most cases the doctor says I saw blood coming from the uterus. It's not what he says. But if the doctor actually ma'isa says that a case yesterday like that a woman had bleeding, had considerable bleeding. She went to the doctor, and the doctor saw considerable amount of blood coming from the uterus. I don't think that we have to have only a guy with a kippah to say that. I think even a guy without a kippah can say that. Even he doesn't. And
l'chor also is something against Eshalavar, meaning someone else could also go.
Exactly, but I don't know. The fact that we can mavar doesn't mean we have to mavar. We don't have to send to another doctor to speak to mavar. So I think we're something on a go with that. Sure, I think so.
Okay. Thank you.
Should know that Dafka Stam often Klali, that it's very good to mention in our shuls and in our communities to speak about the importance of doing a pap smear. Pap smear should be done pretty much annually, and women can get it young, and we know that the HPV virus is deadly. And so Rav Willig told me on several occasions that a woman came to have a shayla on a bedika, and he said, and she knows she was a woman, maybe in the 40s, early 40s, where there's a greater chance of having severe cervical cancer. And he said to her, "When was the last time you did a pap smear?" She said, "I don't know. Yep, I don't know, whatever." So he said, "Fine, go and get a pap smear. I'll give you a psak on the bedika." So he told me several times. So they didn't know Maisi actually did it. But I think that it's a very important Havana, to understand that when we are giving a psak, we are also in charge. We also have to be concerned with the health of our congregants, the health of our people in our sholim. So it's not enough that a person is giving mutar aser. We should realize a woman should be healthy. Men and women should be healthy. So pap smear generally says not a problem. There is what happens. We do a pap smear. Why do we say it's not a problem? A, because it doesn't really go inside the uterus, and B, it is the bleeding that we saw. We caused it. It's a makkah, and it's a makkah from the vagina, not from the uterus. So it's posh matah. What happens is we get a result from the pap smear. The pap smear is a little inconclusive, and it says there's something we don't know what it is. So we're going to do a slightly more in-depth pap smear, and the more in-depth pap smear, we set a slightly longer Q-tip, and we get a little bit deeper inside the beyond the vagina, beyond the cervix. And that, if we hold that the opening of the external os is already the beginning of the uterus, then there's a shayla with that ptichat hakever. Generally, that's not the general psak that's hold, although Rav Vosner is machmir on that. And again, even if we see and it's not really being open because we have a very, very thin thing. We just saw Rav Vosner said it doesn't matter how thin it is. Once you go inside the uterus, will be aser. And remember, if you look at the end of the tips, you'll see that it's also the brush is a little beholder, but the brush is thin, is pliable, flexible, so it isn't open. And the bleeding that we see clearly is not a problem. So according to Kimat, all the Rappoiskim, any type of pap smear is not a problem. We should know that two different types. There's a higher and there's a more deeper one. Colposcopy. Colposcopy is to take. We already did. This is we saw that there's a beginning of cells that are problematic. We saw that there's a growth on the cervix. So colposcopy is more than a speculum. That's already we're taking a high level magnification and we're looking very, very closely at the cervix. A colposcopy should not be confused with a colonoscopy. A colonoscopy is where we look inside the colon. And if you're at the age like me that you should have a colonoscopy, don't go and have a colposcopy. And if you send a woman to colposcopy, make sure she does the colposcopy and not a colonoscopy. They're two different things. They sound the same, but they're different things. Colonoscopy is much less fun. Colposcopy is also it's not a kef. People don't do it for a teal on a Thursday afternoon. However, it's the different treatment. Colposcopy does not go inside the uterus. The shumpanim often, and therefore there shouldn't be a problem. Again, we may see bleeding as a slight abrasion. If a woman says, I went to colposcopy and I saw slight bleeding afterwards, before it was mutter, and afterwards I saw something, so the Chor would say it's the same, otodin, the Chor would be mutter. A colonoscopy is something else. Colonoscopy shouldn't make you Niddah either, especially if you're a man. B'chol, what about an ultrasound? So there are days in ultrasound also, the same svara that you bang it on the cervix. Ultrasound doesn't go inside the uterus. Many women are very, very concerned not to do a vaginal ultrasound because a chashash it'll make you Niddah. So if a vaginal ultrasound makes a woman Niddah, then every time she had relations she'd be Niddah. Exactly the same. Doesn't go much further than the penis during intercourse. So the shaila is then, so why do we do a vaginal ultrasound? So we already spoke about it, I think, before. But the idea is that the ultrasound sends out rays. It works on echolocation, on sending out sound waves, which are then bounce back when they hit hard surfaces. Like when I speak and I shout at the wall in front of me, so the sound comes back. So I'm not able to translate it into how far the wall is, but a bat is able to do that. And the ultrasound is able to do that. And that's what we look. So we see, if you look at the ultrasound, we send out the sound waves. And if you look at the top left-hand corner, you'll see that there's a picture of what you'll see. You'll see the ovary here we have polycystic ovarian syndrome. Here we have a lot of small follicles that are developing around the periphery of the ovary. So ultrasound, why do we do it vaginally? Because we need to get to, let's say we're looking for pregnancy. So we need to get close to the pregnancy. Now, later on in the pregnancy, there's a very short distance between a baby and the abdominal walls, and we can do it abdominally. But initially, when the distance between the abdominal wall and the uterus is too large because the uterus has not expanded, we'll do it vaginally. We're much closer. That's the reason we do it. No other reason. It doesn't make children deaf and doesn't cause them to have ADHD, like all sorts of other kishkushim that people say. So here we have a little more diagrammatic picture. The transducers we see is just inside the vagina. That's not a problem. A polyp. We have a polyp inside the uterus. There is a daya that the polyp, we can have a flat polyp. We can have a polyp with a stalk sticking out. So a woman says, I went to the doctor, I'm bleeding, and I'm bleeding from a polyp. So there's a daya of the Tzitz Eliezer that he says the horror that the polyp is not considered to be dam niddah. Why? Because the polyp itself bleeds. But that isn't actually true. That's actually medically incorrect that the polyp bleeds. The polyp does not bleed. So maybe that's what we'll see in a moment. That maybe the Rav Waldenberg was giving a psak based on the doctor that he asked. What did the Aruch Shalom said this before? To go and ask the doctor, the doctor tells you, that was wrong. But we don't hold like, we think that the medicine that he said is incorrect, and therefore we don't hold like psak. Bleeding from a hematoma. A bleed from a hematoma. A hematoma is a sac of blood that's inside the uterus that is basically bleeding. It's almost exactly the same. It's as bleeding from the endometrial lining. It is exactly the same. And that can happen very much during pregnancy. It can be through the entire pregnancy. It's very problematic. It's very hard to give a head there. But it's a woman becomes a niddah. If she sees a small amount of blood, obviously we call it ktamim. But if she sees a lot of blood, it's hard to be making. So Mordechai Halperin, he says that basically this is an example where the Rabbanim gave a psak based on the medicine that they knew, and the medicine we think today is different, and therefore we don't hold by that. We think that the polyp, bleeding from the polyp and bleeding from hematoma, doesn't make a woman niddah. Unlike the Tzitz Eliezer who said it differently. This is a picture taken at a medical conference in Switzerland a few years ago, and my wife is waiting to have another conference like that again because it's a beautiful location. We had a wonderful Shabbat there, and when it happens, I'll let you guys know. Maybe we'll see you there. So here we see, here's the subchronic hematoma. Here's the baby, and the ultrasound you can see mamash a sack of blood that's bleeding there. So that's dam niddah. And here we see it. We can see it can be no bleeding, can be heavy bleeding, can be light bleeding, a lot of cramping. Those are things that are common. Insertion and removal of the IUD, or bleeding from IUD itself. So the insertion of IUD, lechora, is Gynecological b'dakim. Look how small it is. It's amazing to think that thing is actually prevents pregnancy. That's the exact size of it. Why is that? Because the uterus itself, I've already said many times, is the size and basically the shape of an upturned pear. I think a pear is small. How is that case that it's able to get a baby inside there? It's able to span many, many times. So that's basically the size of the uterus. That's the setting inside the uterus. That's it. The insertion is not a problem, and even maybe the arms, when it's inserted, the arms are closed. It goes in and they open up, and when you pull it out, that's why you have the chud at the end. You pull it, and those arms just basically collapse on themselves. So the actual insertion is only the body that we see here. That's it. It's very small. It's not a problem. The bleeding is already much more problematic. So here we have this introduced through the cervix. Here you can see how thin it is. It's just a little tube, and then it opens up. And then when you withdraw it, you just pull that, and it closes up on itself. That's not a problem. There's no ptichat hakever. They may well be bleeding. If it's a localized bleeding at the beginning, then lechor will call that damaka. If it continues bleeding, then maybe that's a problem that the body is awakened to expel the IUD. And that's already considered to be dam niddah. That's already much more difficult, even though the people that want to be making on that as well. The chorat's kasher to be making on that. Bleeding with a mirena is, of course, a very different situation. The mirena, or the other IUDs that also have a hormonal effect. The hormones cause basically the whole entire uterus to bleed. Mamash looks like dam niddah. There's a guy in Bar Ilan who's doing a PhD thesis on proving what is the source of the bleeding from an IUD, and he got a doctor to do hysteroscopy on women with an IUD, with a mirena, without a mirena. He saw from the mirena, you can see that the bleeding is mamash, the whole uterus is bleeding, like mamash dam niddah, mamash kipshuto. The other IUD, maybe you can say it's a makkah, although that hasn't been proven yet, and therefore in the meantime, we're still machmir. Fibroids. So the fibroids inside the uterus, again, are there was Rav Waldenberg wanted to say that they themselves bleed. They don't bleed. They cause bleeding. They're rubbing against the sides of the uterus, and they cause bleeding on the opposite side. So that is basically, it's causing blood from the uterus. Even though why is that a makkah? Because I didn't cause that to happen. It's not something that's a natural occurrence. That there's a rubbing against the uterus, and we see bleeding. That's the horror is considered to be makkah. So the Mincha Yitzchak, Rav Yitzchak Yaakov Weiss wanted to be makel on that. He has a tshuva they gave to Rav David Kahn, Rav David Cohen. But lechor again, the sign we don't, and Rav David Cohen is makel on a fibroid. But we don't think that generally that's not the psak that's makubal today in the olam ilchati. Exactly what Halperin said before. There's something called a nisha. A nisha is a woman, a niche that a woman gave birth, and she has this little niche that somehow when they gave birth, it like folded inside, and there's blood coming out from this. I see it. You really only see it in Israel. I don't think you see it anywhere else that there's nisha. And you see a woman after birth, a lot of bleeding. That's again difficult to say that it's dam makkah, and it's considered to be dam niddah, and needs to be treated in order to drain, to fix that, and she won't bleed anymore. That's the niche. Let's go back to some of the procedures. What about an HSG? Hydrosonopigogram, in which we are injecting fluid inside the uterus. You remember to see the build and of the uterus, and that the fallopian tubes are open, right? So here we have it in a very diagrammatic sense. We're injecting the fluid inside, and we're seeing it's done under great pressure. So what's the din here? Do we have ptichat kever? Well, let's see. Let's try and look at it here. Here we see that it's open. Here we see that the fallopian tube, one of them is blocked. And here we have, here's where the cannula is. So according to many poskim, that's not considered ptichat kever. Why? Because the cannula only really goes up to the cervix, and then it's single. It's actually a cone, and the cone, the top of the cone is less than ptichat kever. Definitely according to Rav Moshe. I mean, according to Rav Moshe, this clearly itself doesn't make a woman niddah, the pticha. However, it's very common that a woman will see bleeding after doing HSG. Again, if it's localized bleeding, if the woman did a procedure and that day or the next day she's bleeding, then we can say that bleeding comes from a makkah. If she continues bleeding afterwards, hard to say it's a makkah already several days later. There's an excellent question that's again we'll speak about bodeket, is how long can a makkah bleed for? And that's a very good question. That's dependent on many other factors. We'll speak about that when we get to that again. Remember that on the HSG we can see abnormal build inside the uterus. Here we have a bicornate uterus. Here we have a septate. We have a mechitza in the middle. Taking a biopsy, we have a woman is bleeding from the uterus, and we think that maybe there's cancer cells inside the uterus, and so we'll take a biopsy. We'll take a biopsy from the uterus. It's not so common today. It used to be more common when I started. It was much more common than today, but it's still done. So we go in, we put a small catheter, so it's very thin, and we scrape off a few cells from the uterus, and we bring up filament, and we have bleeding, and it's amazing because the guy will bring you the catheter. At the top of the catheter, you see mamash blood. There's a tipa dam kachaldal, mamash a little bit of blood. And what do we say? What's it in there? She's bleeding. Now that goes back to the Chazon Ish. If we say that the makkah is, even if he did it in endometrium, this is clearly makkah. I made this makkah. I went in. I caused it to happen. But if we say that a makkah is only what I cause in the basar, only what I cause in the flesh and the muscle, then this is not considered to be makkah. Because I didn't cause a makkah in the flesh. I cause a makkah in that thing that bleeds when the woman becomes niddah. So that's a nafkamina of the machloket that we saw before in the Chazon Ish, or the havana of the Chazon Ish. And what Rav Shechter with machmir on an endometrial biopsy. Why? Because he's saying endometrial biopsy, we're basically causing bleeding that comes from the endometrial lining. That's mamash dam niddah. Generally, we don't hold like that. Hysteroscopy. So hysteroscopy, we are inserting a thin catheter inside the uterus to see what's going on inside the uterus. The catheter is very, very thin. Generally, the poskim that we saw, we do not have ptichat kever. It's generally about 3 or 4 millimeters. And that's what we saw before when the Nishmat Avram said most of our treatments are there, 3 or 4 millimeters. That's what he's talking about. He's talking about Tzilum Rechem, he's talking about hysteroscopy, he's talking about biopsy, those things that we just talked about. And even if there's bleeding, again, the bleeding is generally an abrasion, so very, very mild bleeding. And of course, with a hysteroscopy, we can see a normal uterine cavity. We can see a polyp here, a very huge polyp, this whole thing. We can see a fibroid, his white thing here at the top. And we can see all sorts of wonderful things in a hysteroscopy. We're not going to go through them today. We can also, of course, do a treatment with hysteroscopy. Today, most treatments that we do, even a hysterectomy, even removing the uterus, is generally done through hysteroscopy. So we do a hysteroscope and we put in a treatment here, and we're removing a fibroid. So we're putting in this probe. These are hot and they're cauterizing it. They're burning off that fibroid. So this probe is all gone through the hysteroscope. Now that's a much larger tube. If we have a diagnostic hysteroscopy, a hysteroscopy in which we did a diagnosis, I want to see what's going on, we have a very thin tube. If we have an operative hysteroscopy, we have a hysteroscopy in which we are doing a treatment, so then we get to a tube that's already about a centimeter wide, about 10 millimeters wide. And therefore, that, according to many poskim, that'll be a problem, not according to Rav Moshe. But etzem, the operative hysteroscopy, etzem the pula, according to Rav Eliyahu, even to Rav Vadia, others, will make a woman niddah. We'll almost always see bleeding there, because we're doing a treatment in which we are cutting something, we're removing something. But again, do we call that treatment? We call that bleeding dam maka. We went in and we caused that bleeding to happen. It's not something that happened naturally, and it's usually very localized. So we'll see bleeding just during the procedure. Afterwards, don't see bleeding. And so those who say p'tichat hakeva will be osir even without the bleeding, and like Rav Osner and others. And there are many, like Rav Moshe, will say it's mutter. A laparoscopy, we're doing a procedure in which we are making a small incision in the abdominal wall and putting in treatment there. That should not cause a woman to be niddah at all. Very rarely you'll see bleeding. It's a question whether that bleeding that comes, let's say, because we move something on the outside of the uterus, will that consider to be dam maka or not? Many will say yes. Rav Eliyahu was machmir. He said, no, that's not a maka. Maka isn't I move the uterus and I cause it to bleed. That's not a maka. Maka is when I went and I cut it. If I cause it to bleed, that's not considered to be a maka, although many are making. A laparoscopy requires an operating room. It's already needs to be under anesthetic, and his operating room. It's already much more difficult than a hysteroscopy, which can be done in a doctor's office. You can't do a laparoscopy in a doctor's office. And one of the last things is to do a hysterectomy. So hysterectomy, what is that? Is that we are going in, generally laparoscopically, they go in, they cut off the ligaments that hold the uterus in place. So uterus held in place. So we can cut those ligaments and the uterus will basically come out. And it comes out in one go. And with all the blood inside, a woman doesn't see bleeding. And so Rav Shlomo Zalman and others will make it on that. They said a hysterectomy itself, unless the woman was niddah before, woman doesn't become niddah. We remove the uterus. We put it all together. Now we had a case the other day when the Rabbanim asked me that they went in. There was some problem with it. Was uterus that was filled with fibroids. They covered it in a sack, in a sakit, and they removed the whole thing. Mamash Rabbi Shoferet. They mamash removed the whole thing in the sack. That's clearly she didn't see any niddah. There was no Rabbi Sarah. There was no niddah at all. So that's a good kula to know. However, we should know it's not so pashut that there are different types of hysterectomy. There can be a very radical hysterectomy, which is removing everything, uterine, ovaries, fallopian tubes, uterus, everything, vagina as well, in which we need to have reconstruction of the vagina. We can have a partial, in which we're only removing the uterus itself. We're leaving the cervix. Now, if the cervix itself can bleed, remember that the cells in the beginning of the cervix are in fact uterine cells. We just saw that before. And so it's possible a woman says, I did a hysterectomy and I'm still bleeding. It's possible she's still getting a period. So it's not so pashut to say that she's never going to get a period again. If we have a total hysterectomy, she won't get a period again. So it's important to see when a woman says, I did a hysterectomy and I'm getting a period, or I'm seeing bleeding, how radical was the hysterectomy that she did. It's important to think of that. Let's talk a little bit about some of the fertility treatments that we've spoken about. IUI, IUI, we're putting something very, very thin inside. Shouldn't be a problem. That's doesn't make a woman Niddah. Sometimes you'll see bleeding, which is generally an abrasion coming from either the speculum itself or the entry of the catheter into through the cervix, which can cause bleeding. IVF, I think there's a lot of misunderstanding about IVF. You'll remember that in order to have egg pickup, we need to get to the ovary. But the way we do it is we don't go through the uterus at all. We go 100% through the vagina. And you'll see here, you take a needle, it's passed through the vagina. There's nothing here there's no tissue in here now. And we'll put it up till the ovary and they'll gather it this way. There's absolutely no bleeding. You'll always see bleeding after an egg pickup, after an egg retrieval, always. But that bleeding is 99.999% of the time will be bleeding that comes 100% from the vagina. And therefore, there's always bleeding and it's always mutter. The woman comes in, I did an IVF, I'm seeing bleeding, muteret. Absolutely no reason. Doesn't have to do b'dika, doesn't do anything, muteret. Absolutely not a problem. The probe that goes in again is not a problem. The ultrasound and then the transfer back of the egg is also not a problem. We're putting a very thin catheter inside the uterus. It's not a problem at all. So that throughout the process of IUI, IVF, not lo moliot shumbaya to make a woman Niddah. I'll just tell you a story over almost 1 minute. So there was a woman called, she had a hysteroscopy, a diagnostic hysteroscopy, and she didn't know whether it was good or not. And she lived in Sfat, she called her Shmuel Eliyahu, the Rav of Sfat. He didn't answer, she left a message. She called Machon Pua and left a message, said, "Someone please contact to me." And she called a Rav from the Beit Din of Rav Vosner. Why? I've no idea. That was why. So the Rav Shmuel Eliyahu go back to her. What's it? I said, muteret. It's the diagnostic hysteroscopy. Muteret doesn't make you need it. She called Machon Pua. Muteret. Rav Eliyahu said, Machon Pua called her back. And she said, "Yeah, I already got a psak. What's muteret?" The Rav from the Beit Din of Rav Vosner called her back. Said, "I already got a psak. What's the psak?" She said, "It was muteret." They said, "Asura." Why Asura? Because it went inside the uterus. Asura. So the woman came back very confused. I understand. My Rav said it's okay. Machon Pua says okay. And this Rav now saying I'm Asura. So she asked me, can I help her out? I called her the Rav and said, "Tegeli ma pshat." He said, because Rav Vosner said every time you go inside the uterus, you're Asura. So I said, but she's not a Talmud Rav Vosner. She asked her Rav, and her Rav said it's mutar. So why do you have to get involved? He said, as Rav Vosner said, it's mutar. So it's Asur, and I'm Neman to Rav Vosner. So according to what you're saying, you should go to every single doctor's lab, and you should wait outside. And any woman who comes out and did a hysteroscopy, you should tell her immediately, you're Asura, even if she didn't ask you at all, because you think it's a crusade to say that Rav Vosner's right. He didn't like my answer. But I think I'm right. Like in the end of the day, there's a machlokas. So if you tell me I hold like Rav Vosner always, mitzuyan. But if someone didn't hold like Rav Vosner, and nearly that Rav Poskim don't hold like Rav Vosner, as they're ready that ein siba la esor. So what I wanted to say today. If anybody has a question, this is this month to ask. If not, anamne pered kiyedidim.
Just to review the insertion of the IUD, making Niddah or not Niddah. So the Paragard, it's for sure damaka, but with the
bleeding that you see, that's initially according to Rav Vosner be aso, because anytime you go inside the uterus, be aso. But the initial bleeding that you see is it's a damaka.
Even with the Mirena, or only the Paragard?
Even with the Mirena, initially the initial bleeding is not a problem. It takes time for the body to start trying to reject it, or the body to awaken to start bleeding because of the hormones. It doesn't happen immediately. The initial bleeding is a mark. Beseda, Besarot Tovot, Yom Tov. Next week we're changing the clock, so we'll catch up to you as well, or we'll come back to you. You'll catch up to us, whatever we're saying. Besarot Tovot, Kol Tov, Shalom, Shalom.